Diagnosis and treatment of dysfunctional uterine bleeding. Causes and symptoms. At childbearing age, inflammatory processes of the reproductive system, diseases of the endocrine glands, surgical termination of pregnancy, stress, etc. are common causes of ovarian dysfunction and uterine bleeding. The clinical presentation of uterine bleeding at any age is characterized by long-term spots that appear after a significant delay in menstruation and are accompanied by symptoms of anemia, pallor, dizziness, weakness, headache, fatigue, lowering blood pressure. Diagnosis and treatment. When diagnosing dysfunctional uterine bleeding, several specialists should be consulted: gynecologist, endocrinologist, neurologist. Doctors determine medical history data, evaluate the development of secondary sexual characteristics, physical development. Blood tests, pelvic ultrasound, thyroid gland and adrenal glands, MRI of the brain are prescribed to rule out tumor lesions of the pituitary gland. The main task in the treatment of uterine bleeding is hemostatic measures. Further treatment tactics are aimed at preventing recurrent uterine bleeding and normalizing the menstrual cycle. Modern gynecology has several conservative and surgical methods to stop bleeding from a dysfunctional uterus in its arsenal. The choice of hemostatic therapy method is determined by the general condition of the patient and the amount of blood loss. With moderate anemia, hemoglobin above 100 g/L, drugs that reduce the uterus are used. Bloody discharge usually stops 5 to 6 days after the end of the drug.